past when you're a pre-medical person. Anything you do to get out in the world, to see its complexity, to work on a problem, make friends and collaborate, that's what you're going to use if you turn into a nurse or a doctor. You know, the biology and the pathophysiology, somebody can teach you in the book, but ways to work with colleagues, ways to understand the world, ways to keep yourself from getting too, too narrow or too parochial. That's a bigger challenge. And so, bust it open when you're a student, and then you may not have a choice but to do this kind of stuff, and then I think you could be happy. Does that make sense? This is funny. I met Noam Chomsky like the first week of medical school. A friend of Paul's, and he came to talk. And Paul introduced me. He said, "Oh, he's my friend. We work in Haiti together." And Chomsky just looked at me and he said, "Oh yeah, so we're going to co-opt you too." And I thought, that's a little broken, old man. But he meant it as a I think he meant it as a challenge. Like, don't get sucked up into the Harvard Medical School thing. Work on what you're working on. And I love keeping that in my head as a little bit of a challenge. Like, keep my bearing from the stuff that brought me there, first of all. And it worked out. I still have the debts, but other than that, I'm hopefully not too brainwashed. Yeah.
I did have a question about NGOs, the role of NGOs in relief and reconstruction, really. One of the abiding criticisms of NGOs from the beginning was that there was very little effort made to coordinate the efforts, and that in some instances they're even working at cross purposes to one another. Has anything evolved in the national government or otherwise that serves to integrate and coordinate the efforts of all these different NGOs?
Yeah, that's a great question. There are mechanisms to coordinate through the government. They're not used by NGOs. So the biggest problem is subscribing and actually working with them. So if you want to work on health, it's very easy who you get your authority from and who you should collaborate with, but only a handful of NGOs have actually started to use that mechanism. And Haiti doesn't have the governmental force to impose, so that's an unsolved question. But same with education, same with roads and sanitation, and there are means, but they kind of need to be invested in, and they certainly need to be participated in. And so, not to make it too easy an answer, but that's kind of where it's at. There are official means to do all these things, but they're not used by the international community. And that's the international community's choice at this point. Haiti can't impose it. If I wanted to practice in Malawi, I would be required, regardless of my specialty and credentials and education, I would be required to spend 3 months in the capital with the Ministry of Health, learning about their medical system, about what their priorities are and how they work. And then I could go see patients. In 15 years, I've never been asked for a credential in Haiti, and that's sad, it's tough. In the disaster period, it was extraordinary. And, there were some really tough experiences that happened during that time, and I'm sure that's part of what you know.
Well, cholera itself, cholera was introduced by relief agencies or
by the UN
troops coming in.
Very. I've been working with some. There's an interesting lawsuit now against the UN Peacekeeping Mission from a Haitian law organization with our collaboration that's basically challenging this reality and asking the UN to be accountable to what's happened and to help clean up the problem. And if I can send any of you, or just on Facebook, we've launched a little awareness campaign, and we'll hopefully do some public events in New York soon about the cholera epidemic. The real challenge is, there's this reality of the disease and this epidemic, but there's also the outrageous legal protections that the UN has afforded that need to be challenged, and this case may actually penetrate that wall of impunity. So I think that's a very interesting thing to stay tuned with. The UN Security Council was just in Haiti this last couple of weeks and was not planning to think about cholera, but now they are. So we're not to get ahead, but I think this little campaign is having some consequences. So we'll see. Yes.
So I know you guys are implementing a new residency program for the Haitians who graduate from medical school from there. But have you guys thought about, since you're opening up such a large hospital, will there be opportunities for residencies from students who graduate in other, like from the U.S.? for example? Like
Yeah.
opening up 2 or 3 year residencies maybe for just family practice physicians?
It's the only way this hospital, the new hospital, is going to arrive is with these kind of collaborations. So there's never been a neonatal ICU or a proper adult ICU or a working emergency room or a labor and delivery center of this size, and so all those things are going to take partnerships, and the expertise may not even be in Haiti, so these partnerships are what's going to let it fly. On our side, here in the States, I do inpatient hospital care, and so me and a number of colleagues from UCSF and a couple of other folks around the country are working on how to organize our inpatient hospital service so that it is a proper, so it does well by people, but also so that it's a good teaching vehicle. Yeah, so I think, I know over the next years these things will grow substantially. It's the only way it's going to. We've not had this level of collaboration ever before. The Partners in Health has grown up almost entirely within Haiti on the Haitian side, but now we are going to rely on these partnerships. So it's exciting. I'm going to Haiti tomorrow, if the snow doesn't stop, with a cardiologist from the University of Miami to look at some kids who need heart surgery. Once we get that information, we can come back here and start find them a spot to get that surgical care, which isn't available on the island. So all these things take expertise that's way past mine.
I was going to ask, when you showed us the map of where PIH is active, the Middle East was a big hole there.
Yeah.
So can you tell us, I know you've done research about that in Iraq.
Sure.
So can you tell us a little bit about that? Your interest in that area. Do you see those partnerships being developed eventually in the Middle East?
Yeah, that's a great question. The way that we've worked has always been at an invitation or an opening from a national government, and for the Middle East we just haven't had that chance. Although there's a large project in Kazakhstan, if that counts. It's a technical TB program that's just been launched in the last couple of years. For me, the work I did around the Iraq War and the consequences of political or military violence, both to combatants and our troops and to civilians, really grew out of a friendship, a personal friendship with an Iraqi physician who I'm still in close touch with. And it's, as yet, it's too unsafe to get there, so I haven't been there with him, and he's living in the UK at this point. But I hope on that front, personally, in the next five or so years, to be able to do some of the medical education rebuilding. Iraq, before the war, had some of the best medical care available in that region, and in many ways parallel to the best in the world. And that's been undermined by all that's happened. But it can and should be rebuilt again, and I think our nation has a particular responsibility for that. So some rebuilding at that level, I think, would be tremendous. Yeah, it would be appropriate and tremendous. And the resources are there. It's a very different terrain than, say, Latin America, where there's just bulk lack of economy. In many parts of that, in many parts of the Middle East, the money's available, or at least around, and then these kind of